So something happened last night. I've been doing night duty and I'm through with it. Something happened last night. So one woman, I delivered her baby at 8 a.m. She was shouting, "I cannot do it again. I want to do cesarean section. I want to do cesarean section. I want to do cesarean section." Labor that you suffered since morning till the stage of 8 a.m. Especially when you do induction. Induction can take longer time. So you bear the pain from 1 cm to 8 cm. At 8 cm, you are shouting, "You cannot do it again. You cannot do it again." 8 cm is known as transition stage. This stage is very painful, I know, but this is the shortest stage that you can be into. It is a stage that brings you closer to your baby. So the stronger the pains, the high chances you have of seeing your baby. So if the pain is coming and you are feeling like pushing, and then your midwife or your nurse is telling you, "Please do not push, please do not push," because at that stage you will having that urge to push. Some will tell you, "Nurse, I want to shit, not I want to shit." That shit is your baby's cell, which cell is down, and you have having that urge to push the shit out. So at that 8 cm, if you try pushing that baby because you cannot bear the pains again, what's going to happen is that you're going to have cervical laceration. And cervical laceration, if not noticed on time, that woman can bleed to death. So to avoid having that cervical laceration, how do you cope with this pain? Please, at 8 cm, first of all, what you are going to do is to do what is called control breathing. You breathe in through your nose and breathe out through your mouth. You do it gently, consistently. But if the urge is much, you can do panting, which is you can do it that way. Then if you are lying down and you cannot bear the pain, please, my dear, stand up. Stand up. If you feel like squatting, squat. If you feel like kneeling down, kneel. If you feel any position you're going to assume that will make you to not to have that urge as you're having it, please assume that position, but do not lie flat. Do not do that. Again, if you have anyone that come with you to that level, please, that person should be actively massaging your sacral region. You should be massaging the your lower back. By doing that, it can help you to bear with the pain, pending when the nurse will tell you to push out your baby. Another thing you are going to do, if you've reached 8 cm, is to understand that you are about to give birth to your child. The nurse or whoever that you come with, their duty is to encourage you so that you can be able to bear on with the pain till you deliver. That encouragement goes a long way. It goes a long way. So at that 8 cm, just know that it is known as transition phase. It is more painful, but very, very, very short. So it's not going to last. So the idea of shouting, "You want to do CS, want to do CS," when you have bear the pain from 1 cm to 10 cm, to 8 cm, I said you want to do cesarean section. If that is the case, you can actually go for cesarean section at the beginning. I don't even like it when I will monitor you till 8 cm dilatation because of the baby shouting want to do cesarean section. Please assume any position you know you're going to assume, because you are the one that is having the pain. You are the one that knows how and where is paining you. Assume it to your nurse tells you to push before you attempt pushing out your baby. So if you watch this far, please make sure you do whatever I'm saying in this video, because the update I drop is a practical things I'm saying in the labor room. Then share it to someone that will love it, and then follow for more. Thank you.